Hello out there. Hello, everyone. So today is Thursday, and you're used to seeing me a little bit earlier for my 2-minute emergencies. But today we're doing something completely different. I am here with a special called Heart, Health, and Hormones. Oh, that was tough getting that out. And I have with me tonight a very special guest. This is one of my great friends. This is Dr. LaKeischa. And Dr. LaKeischa is a board-certified integrative gynecologist. And she's going to explain what that means. But in case you're tuning in for the first time, I am Dr. Leslie. I am a board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I help bring you information about medical issues to keep you healthy, safe, and out of the emergency department. So, Dr. LaKeischa, welcome.
Thank you so much, Dr. Leslie, for letting me be on your emergency, 2-minute emergency this evening. I'm so excited to be here.
And as you can imagine, this is going to take a little longer than 2 minutes tonight because we want to make sure you get information that you can truly use. All right.
Yes.
So this is American Heart Month.
Mm-hmm.
And it's also Black History Month. So I want to give you a little bit of information since we were talking about heart. I'm going to put it all together. And I'm going to tell you a little bit of information about a physician, a surgeon by the name of Dr. Daniel Hale Williams. So a lot of people have heard about him, at least I hope so. He was the very first American to ever perform a successful open heart surgery. And that was to repair a wound. Now, I said he was the first American. He also happens to be the first African-American cardiovascular surgeon.
Mm-hmm.
So he did that surgery was in 1893. And after that, he also founded a hospital called Freedman's Hospital, which later became Cook County Hospital in Chicago.
Is that
Yes. He went to Chicago Medical College. Now, I graduated from Chicago Medical School. Different. Chicago Medical College became Northwestern University.
Okay.
So, yes, he also helped start one of the first nursing programs in the country for African-American nurses. So there's a lot to be said for Dr. Daniel Hale Williams.
Yes.
So, very impressive. And keep in mind that surgery was done, let's see, he had no x-rays. He had no antibiotics. He had no modern equipment, none of that. And his patient, I said successful surgery, his patient walked out of the hospital 51 days later.
Dr. Leslie, that speaks volumes because that means, okay, so I'm on a little of anatomy of an anatomy geek.
Okay.
I love knowing where things are in the body. So that means he really had to think in his head and really picture where things were located. And I mean, just all that great stuff. That's amazing. Like you said, successfully completed. Wow.
Yes.
Okay.
Yeah. And keep in mind, people can have little differences from one person to another. So not only did he have to know, okay, the atlases that I've seen before, this vessel's here, this vessel's there, but there can be some variations. So what if that vessel's here instead of there?
Exactly. I say to my patients all the time, your body didn't read the textbook.
Exactly. Yes.
So, when things are not just, according to plan or, my patient gets a little frustrated, I said, now remember, everybody's body doesn't read the textbooks. So we have the basics, but we always have to make it customizable for you and personalized.
Yes. So, Dr. LaKeischa, you are a hormone expert. Is that right?
Yes, I am, Dr. Leslie. I am an integrative gynecologist and a hormone specialist. And what I do is I help women in that perimenopausal, menopausal phase of life that are struggling with depleting hormones. I help them get their hormones balanced so they can regain their mental sharpness, have enough energy to last the entire day, and remember just how beautiful and vital they are.
Wonderful. Well, I'm not going to give away my age, but let's say if I happen to be menopausal, just a little bit, it sounds like you are the woman to go to.
Absolutely. I believe it is becoming my mission to help women to glide into and not slam into perimenopause and menopause. Because we have not been having this conversation very openly over the years. I tell people all the time, I give you the talk 2.0, the part of the talk that your mother did not have the verbiage to give you, because they didn't have the language. They didn't know what this was. Their bodies were changing. They were waking up in bodies they didn't even recognize anymore. Mm-hmm. And so to be able to sit around and say, I'm feeling this way because your mood is different, because you're not recognizing who you are as a person even. Sometimes you don't even like you, because you don't even have the elasticity in your rubber band anymore. Things that you used to be able to juggle with ease and be able to put things where they're supposed to be and do your little checklist. It's becoming a Herculean effort to do that now.
And to remember where you put those things. You may put them in the right place, but where did I put it?
Exactly. So to be able to say that in a way that someone is really hearing you and understanding what's going on with you is where I come into the picture, and then give you tools, be it medication, be it bioidentical hormones, be it lifestyle changes, gut health changes. Those are all the different areas that I focus on so that we can get you, like I said, remembering just how beautiful and vital you are.
Wonderful. It is so desperately needed. And I want to give a shout out to Karen. Karen, thank you so much for joining us this evening. And Dr. Tershel, thanks for joining us, Tershel. We hope to give you some great information. So the subject for today is heart health and hormones. Mm-hmm. I know that women have heart attacks.
Yeah.
Of course we do. But what does that have to do with our hormones? I mean, I've always heard, you hear about men having heart attacks all the time. Mm-hmm, mm-hmm. But you don't really hear that often about women having heart attacks.
What happens with women, and this is becoming an evolving story, is that women present differently. That's number one. Mm-hmm. Is what we're learning is that, we used to hear about the classic presentation, the elephant sitting on your chest, or you feeling like somebody's crushing you. You can't breathe. You have the pain radiating down the left arm. You feel nauseated. You're short of breath. You may even have pain in the chest. Women don't present like that always. Now, I do have one friend whose mother presented classic presentation, mm-hmm. and they still dismissed her because she was a woman. And she had to become her own advocate. So that's a whole nother story, ladies. We'll talk about that. But women usually present atypical or very different. So I have another story of a friend of our family's, and she was actually, it was around Thanksgiving time. She was doing her regular cooking, kind of pushing herself a little bit, and just felt fatigued and had heartburn that just would not respond to her Tums.
Okay.
It was like this, I'm probably pushing it a little bit. I'm tired. I'm just really, really, I said I'd cook for more people than usual, that type of a presentation. And so what we're starting to have the conversation about as well is that we notice that women start having heart attacks more as they get older in life, as they mature more. And so what researchers and what the medical establishment kind of did was they took a step back and they said, hey, why is it when women are younger, they don't necessarily have the rate of heart attacks that they do when they're older? And why is there a difference between men and women? And so they started looking at our hormones, and they started looking at the protective effect of our hormones. And that's kind of what sparked the WHI study that came out in 2002. It was, hey, there must be some protective effect with these hormones. So let's give women that are menopausal, let's give them their hormones back. And let's see if we can prevent them from having a second cardiovascular event.
So you mean to tell me this is something that's just been realized within the past 20 years? That there are differences like this? I mean, I've been practicing in the emergency department for 20 years, and I know that we get presentations totally different. Sometimes, like you said, just fatigue. I'm tired. I don't know why I'm tired. I slept well last night. I haven't changed anything, but I'm just tired. Or having some difficulty breathing.
Yes.
And a lot of people will not say chest pain. They don't use the word pain. They will. So we're very careful in the ER to not say, are you having any chest pain? Are you having any chest discomfort?
Yes.
Totally different.
Yes.
Because that covers the gamut of everything.
Yes. Yes, so, it does.
Much better way for us to phrase it. Yes.
And I'm so glad that you use that different terminology, because that's the second story in my life of, someone that is so close to me, I call her an aunt. And so I was talking to her a few years ago where she was sharing her story, and I was interviewing her, and she said, what happened is she was out walking with her husband. They were doing their regular morning walk, and she just couldn't catch her breath. It got harder and harder to catch her breath. And she actually sent him back to go get the car. She was like, I don't think I can walk back to the car. And she's a nurse. Now she's a nurse. Oh. Okay. And she says when she got, the whole story goes where she finally ends up in the office. Her husband's a pastor, and they had a cardiologist in their congregation. He's like, come on over, does a workup. She has 4 blocked vessels.
Wow.
And they say, well, when they're doing the initial workup, they said, you've actually had a tiny heart attack. And she says, I remember possibly when that happened. They were on their way on a trip, and she's in the airport, and she says she remembers this kind of grab in her chest. Is this like little, and then it went away. And she's like, okay, gotta go, gotta keep going. So she did not, and she says, I'm a nurse, and I did not say it was pain. She said it wasn't painful. It was a moment that caught my attention because it was uncomfortable.
Right. So we have to be especially vigilant, not only when you feel like, okay, this is bad, I need to go be seen right away. We have to be careful of those little hints that just tells us something's not right. And we as women, we typically, but I've got to go finish this first. I don't have time for that. I've got to do something for the kids, for the grandkids. I've got to, do something for the church. I've got to get all this done. I don't have time. So this isn't so bad. It's just a little discomfort. I'll be fine.
You said it. We're giving from empty cups, and we keep pushing and pushing ourselves. And when I talk to my patients, I tell them all the time, I'm preaching to myself. When I'm telling you, what are you doing to restore yourself? What restorative practices are you using? Because it's not just about what can I give you? What Band-Aid can I slap on this problem? It is, hey, let's do some integration. Let's see where everything is coming together, and let's see what's best for you. And so what the conversations that I'm having is talking about how stress relates to our health, how it can impact the physiology of our health, and then educating about what hormones do. And so going back to that study, the WHI study, like I said, what they did was they looked at women that were 63 years and older who had had a known cardiovascular event. and they were trying to prevent a second event from happening, be it a heart attack or stroke. And they said, hey, if we just give them estrogens, then we know that estrogens have this protective effect. We know estrogens can make sure that you don't make too much cholesterol. We know that estrogens kind of help the integrity of the blood vessels. Why don't we do that? Well, there's a difference between the estrogen that we make and the estrogens that they gave those poor women.
I see. All right. All right. Tell us about that.
Those estrogens were synthetic estrogens where they actually they used horse urine and made these products, Primpro and Premarin. We have no business ingesting horse urine. Okay?
I know it has its place.
I know, but no.
Not what I would like to take. No.
And what they saw was that there was actually an increased risk in having a second event. And so these women actually had another heart attack, or they had a stroke, some type of cardiovascular event. And that's why they had to stop the study. And they stopped the study because this particular outcome, they were having a deleterious effect. And so they said, hey, halt. And what happened is we didn't have the follow-up conversations. So we didn't say, hey, this is what it was. These are who they looked at, the women. How does this translate to you as a perimenopausal woman who can be in this phase for 10 years before you actually stop your period and go into menopause? How did this look for women that didn't have a history of cardiovascular event? How did this look for, how can we extrapolate this for you, for this particular patient right now? And that's where the conversations I have come in, because we're finding that estradiols, that progesterone in those bioidentical forms, and the testosterone even in bioidentical form, have their place and protective effects. And so this is something that I give as a tool in the toolbox to help with the quality of life that you're having as you're basically, you're in that phase of life where, look, you've got the wisdom of your years. You know exactly what's going on, and you just need your body to cooperate.
Amen.
That's it. That's all we're asking.
Right. So all along, I had been told, or, I've seen things that, oh, well, you should take hormones, but then your risk of cancer is going to go up. But then is it protective? Is it harmful? I'm not sure. If you're a smoker, what's going to happen? There's so much information out there when we hear from two different opposing views that it confuses people. And I remember that when my mother was going through this, it was, well, probably shouldn't take anything. You're just going to have to suffer with this, because if you take something, your risks for other issues are going to get worse. So Is it safe?
That's a great question. And the preamble to that is exactly what I get all the time. So I get asked all the time about, okay, what are my risks? Because you hear hormones and you associate bad. It's like all of a sudden hormones bad. Don't do that. Well, we need to talk about what these hormones that we're dealing with now are. They're bioidentical. They look just like what your body was making when you were having those levels at the right levels. And those hormones have a purpose. They have a reason for being there. And so when the WHI study came out and a lot of women, were taken off their hormones, then there was this resurgence of, okay, do hormones, because these women were suffering with these symptoms of hot flashes, night sweats, vaginal dryness, not being able to sleep, being, exhausted the next day. And so they were saying, okay, you can use these. It's the same synthetic ones now, but in the lowest dose for the shortest amount of time.
All right.
And that was the mantra. And that's still the mantra for most physicians. If you go into your doctor, they'll say, okay, I'll put you on this, but really low dose, short amount of time. And it's funny to me because if you look at even the dosage that's out there for hormones, for bioidentical hormones, when you're replenishing hormones, it's so much different and lower than what's even in birth control pills.
Oh, really?
Actually have a higher dose of estrogen, which is a synthetic, progestin as well,
Mhm.
in birth control pills than you do when you're on bioidentical hormone replacement therapy. Now,
So
oh, go ahead.
I was going to say, so if they say the lowest dose for the shortest amount of time, but you also said you can be perimenopausal for 10 years.
Hello. So
That's not a short time.
no, it's not. No, it's not. And that's what was happening, where they were taking women off like within 5 years. Women were still suffering. They're still having they're still having night sweats or fatigue or not feeling their best or weight gain and all these things that are happening. And so they're just like, what do I do? How do I have this conversation with a doctor that may not be going through the same thing I'm going through and not understand what I'm saying? And so the conversations that I have, of course, we do go through your medical history. We say, okay, exactly, what are your habits? Because you did mention smoking, and that's significant because that does increase your risk of blood clots. I mean, hormones just on board, period. I mean, that increases a risk. So we do have that conversation as well. We also know that, looking at studies coming out of the UK or from our friends across the pond is what I say. When we look at their studies, they actually study bioidentical hormones and how they actually can help different systems in the body. So for testosterone, we have come to find that there's a protective effect with breast tissue. So that could even be why, as we get older, our risk for breast cancer actually increases because we've lost some of the protection. We actually have a protective effect with testosterone with colorectal cancer. So those are the things that we never really talk about and have in the discussion. And I'm so glad that you've brought that up this evening, that is part of the discussion. Okay. I'm going to pat you on the back.
So, what about the effects of, for me, for example, I consider myself to be rather healthy. I don't smoke. I exercise fairly regularly. But I have family history. So, my father's first heart attack was before I was even born.
Mm.
He had his first heart attack at age 40.
Wow.
And he did have diabetes. So that obviously increases risk factor. But I would say for the most part, he wasn't obese, nothing like that. And as a result, he ate very well. But he was just one of those people that was destined to have cardiovascular disease to the point where he had 13, yes, 13 documented MIs, heart attacks. 13 heart attacks. And he even had quintuple bypass. That means he had 5 blocked vessels that all needed to be taken care of. So, but my father was a very strong man. That didn't hold him down at all. He just kept going. He just kept going.
Wow.
So for somebody like me who has those risk factors, would I need to do something different? Or would this be just even that much more important that I make sure that I keep my hormones balanced?
Absolutely. I'm so glad you brought up that point because, depending on the etiology of, like you said, your dad had diabetes. So that actually, does have a risk of messing with the integrity of the blood vessels. We know that. For women, and so diabetes, we know can have, it's actually, associated with lifestyle changes and things like that. And so for women, to make sure that the integrity of the blood vessels are kept intact, as well as your cholesterol pathways, is actually advantageous for you to be on an estradiol and keep your estradiol levels up as you're going through menopause. Because that can because that drop in the estradiol can increase your risk for developing a high cholesterol. It can that can actually mess with the integrity of the blood vessels. And so as the blood vessel integrity gets, not as good, and then you have these, you have injury to the blood vessel. The way that we patch up injury to the blood vessel is by cholesterol patches. And that cholesterol, if it's not the best cholesterol, now you have more increased risk for that cardiovascular event.
Okay. So if you have that family history, then you have that extra job. You have to be extra vigilant.
Yes, absolutely. Absolutely.
You are giving us plenty of information here, Dr. LaKeisha. This is wonderful.
I love to talk.
It's the passion that you have for this that helps so many people. It really is. Yes. So let's see. I also heard that everybody tend to have, there's a couple of different times where heart attacks are more frequent. They're more frequent in the morning. And they're also more frequent Monday mornings. Now, those are coming from two different angles there. Yeah. The Monday morning is because for most people, you and I are a little different, but for most people that do that 9 to 5, Monday through Friday, they've had that great weekend, they relaxed, or in some cases they did more than they do during the week. But now all of a sudden it's Monday morning. I have to go back to work. I'm at a job I don't like. Everybody's stressing me out. They're putting too much on me. And stress just hits.
Yes.
And also I heard, as far as it being in the morning in the first place, is that has something to do with our cortisol levels, which are different depending on the time of the day. Is there anything you can tell us about that?
Oh my goodness, Dr. Leslie, you just have me in my wheelhouse tonight. Oh goodness. So cortisol is one of those stress hormones that we have. And when your body is in a stress response, the adrenal glands can produce more of the cortisol than it should be. Now, cortisol should be highest in the morning because that is one of the hormones that help you wake up ready to face the day. And over the day, it should start drifting down so that you can wind down, turn the brain off, land the plane, and go to sleep. Okay. Well, when there is a stress response and when there's inflammation in the body, you actually start converting cortisol to cortisone, which is another type of cortisol molecule. And that cortisone is more inflammatory and sticky. And that can interact with your cholesterol levels, causing inflammation in the vessels. And I tell people, think of inflammation in the vessels like Velcro. So you have those two sides to Velcro and they have to like stick together. And so I have more of that Velcro sticking together on the sides of the walls. So you have the cholesterol and the inflammation on the wall and they stick together. Now you're narrowing that lumen. You're causing it to get more narrow. And so the blood flow that's going through there is just not the same. If you guys remember when we were little, we used to step on the garden hose and cause that water to not go through to the other end. And then when you lift your foot off, it goes through. So that's what you're doing. You're kind of stepping on the blood vessels and causing them to constrict. And when you cause them to constrict, you decrease blood flow downstream rather. And that is actually the typical definition of a heart attack. It's ischemia. So it's lack of blood flow to that muscle, and the muscle then dies. And part of that death response you're feeling is the pain and cytokines and inflammation happening.
So in addition to us watching what we eat, exercising, drinking plenty of water, visiting our physicians regularly, not just when we have a problem, but doing preventative medicine.
Yes.
We also need to lower our stress levels.
Dr. Leslie, ouch, you're stepping on my toes. How are we supposed to do that? That's what I do all the time because I say the same thing.
I have a few suggestions.
Okay.
So a couple of the things is you mentioned the cortisol levels go down to help us wind down.
Mm-hmm. Mm-hmm.
But one of the things a lot of us do is we go to sleep with the television on.
Ouch.
Did I hit a nerve there? So that doesn't allow our brains to turn off. And yet we expect to go right into a restful sleep.
Mm-hmm. Mm-hmm. Mm-hmm.
Well, your brain has to have a little bit of downtime. It needs to relax. So simple things like turning off the computer. Yes, I said the computer. I said the television. And yes, the phone.
Oh, ouch.
Because you're still looking at those screens. The last thing you do before you shut the light off is you're looking at the screen.
Ouch, ouch. Ah.
We need to cut back on all of that.
All of it, all of it, all of it. And it's so funny when I say this to my patients, I raise my hand. I say, hi, I'm Dr. LaKeisha, and I, need to do the same things too. I feel like I'm in a support group, right? Because it's the same thing. I had to start leaving my computer downstairs in the office area because I would take it upstairs in the bed and I'd be hunched over and still doing stuff. And I'd, flip it down, put it on the floor, and then it's right back up. Oh, wait.
Right. Yes. I forgot to. Yep. Yeah. Yes. It happens. Other things we can do. We mentioned exercise, but we didn't say anything about meditation. Which meditation has so many different forms. Like some people think you have to be sitting in lotus position on, some rocky floor in the middle of, I don't know, the beach or the desert. I don't know. Meditation is what you get right on mountaintop. Exactly. That is meditation for some people.
Yes. Yes.
But for most of us, that's not reality for meditation.
Mm-hmm. Mm-hmm.
Meditation can take many forms. Meditation can actually be sitting in silence, but it can also be reading something. It can be listening to some music. It can be exercising, can actually be meditation. It's where you're allowing your mind to relax, to think about things, but not to, how do I say, worry about things. It's more like, okay,
like that.
What do I need to get my day started? I need to think inward. I need to think about how to be my best self during that day.
Mm-hmm, mm-hmm.
I can think about, okay, so I know I have all this work to do, but how do I make somebody else happy or smile that day?
I like that. Yes. Yes.
There's so many different parts to it. And for some people, meditation is reading the Bible. It can be prayer. It can be, there's so many things. So you have to figure out what is your best form of meditation. There is no one easy answer.
Yes. Oh, that's well said. I love that. I love that. And that's one thing too, I've been sharing with my patients is that they're the different forms of meditation, and that I have learned that my form that really feeds my soul is moving meditation.
Okay.
Sitting still to try and nope, not gonna work. Brain gonna be all over the place. But being able to be in some type of motion, either rocking or moving on my heels or balls of the feet, even doing some yoga, some type of yoga practices, and being in some type of movement has really been helpful for me.
And a lot of people think that, well, I don't know how to get into that. I don't know where to find it. Once again, I know the all-powerful computer, phone, whatever. You can find a YouTube for anything.
Yes. Yes. I call it YouTube University.
Exactly. If you're interested, it is out there for you.
Yes, absolutely.
You don't have to go to a class. It's there. So, Dr. LaKeisha, this has been so wonderful. I am so glad that you were able to join me this evening.
Thank you so much. I have enjoyed myself. Like I said, I love to run my mouth, and thank you for letting me do so. I love education and being able to give information and empower women for generations to come to understand that balancing their hormones is really important and crucial to having optimal health.
Absolutely. Absolutely. And Dr. LaKeisha, is there a way that people can find out more about what you do, how they can get in touch with you?
Absolutely. If you go to hormonequiz.co, you can grab a freebie from me. So go to hormonequiz.co.
Okay.
I'll make sure of that for you really quick.
I'm putting it on there. There you go.
And if you want to do a free strategy session with me, you can do that at talkhormones.com.
All right. Talk. Let's make sure I spelled it right. Talkhormones.com?
Yes, talkhormones.com.
Oh.
That is a free strategy session with me. And the freebie is hormonequiz.co. Yes, hormonequiz.co. Sorry,
Okay.
just about that.
Well, I hope people take advantage of this. As you can see, Dr. LaKeisha is a wealth of information. And if you are premenopausal, because you have to be prepared, perimenopausal, or postmenopausal, she has information for you. So I hope you take her up on this. And I think we're going to wrap it up. I am Dr. Leslie, your board-certified emergency physician, best-selling author, international speaker, and professional photographer. And you can find a little bit more about me if you go to drlesliesharp.com. And I will be back here again. I'm here every Tuesday and Thursday, typically at 6 p.m. Eastern, 5 p.m. Central, and I will have more information on 2-minute emergencies. So until then, stay healthy, stay safe, and stay out of the emergency department. Take care, everybody. Thanks for joining us. Bye.